I'm Warnyta Minnard. I'm a patient advocate from the Netherlands. I have co-founded a Dutch patient organization focused on helping cancer of unknown primary patients and their relatives and family members. And for us, precision oncology is the only way that you can help cancer of unknown primary patients, because traditional diagnostics are not able to find the primary tumors. There's hardly any chances for these patients, and with more molecular profiling, mutations could be found and patients could actually be treated. So I feel like the CUP patients used to be always lagging, but now in this new day and age, they're actually more at the forefront. And I'm also setting up the International CUP Patient Organization together with similar advocates in different countries. I recently joined FT3 as a member. I was involved in the community of practice because we had some success on advocating for reimbursement for whole genome sequencing in the Netherlands. So I was able to share the lessons with other members, and I felt like now it's also the time, now that we're more expanding internationally, to become a member as well and to learn and to exchange lessons with other stakeholders. And at the same time, I feel with CUP, it's kind of a specific indication. And I think if you do something for CUP, technically you do something also for other cancer patients, because a CUP patient might end up being a lung patient, might end up being a colorectal patient. So it's also good to be more aware of other stakeholders. And I really love to explore more internationally. So that's why I joined. I think collaboration is really important because I feel patients, they're all subjected to different health systems, different sort of local settings. But, I think in the end, patients all want the same. And I think by uniting our voices, we have a much stronger voice, and we can also really help patients in other countries and exchange and learn. And I feel like if everyone tries to reinvent the wheel on its own, you never really have, a big, powerful voice. But I feel like the patient voice is so strong, and often, in many situations, the patient voice still has to be developed or can still grow. And I feel like joining an international group, you can expedite that process of empowering the patient's voice. Yeah, this morning during the community of practice meeting, we really worked with Team Spain to sort of see how we could sort of move their pilot to the next phase. And what was really interesting, that I was able to show to them something that we did in the Netherlands after we got reimbursement for sequencing, given there will be public reimbursement soon. We worked with the professional bodies of the oncologists, the pathologists, to sort of come up with a diagnostic sort of guideline, not like a clinical guideline, but more of a guideline when to test, what the timing should be, sort of more of the logistics. And I was really able to share on that, and they asked, can you share that document? So I thought that was a good exchange. So it was really helpful, happy to help other countries also succeed.